inviting me to the conference today. Yes, what I'm going to do is just really give you a bit more information about the new partnership between Adfam, EATA, the Alliance and DrugScope. And we are calling it the Drug Sector Partnership. We've got a meeting on Thursday in which we'll be looking at sort of sorting out logos and that sort of thing. And basically we're still relatively new to the project. Basically what we've got is funding from the Department of Health, what used to be called the Section 64 programme is now the Third Sector Investment Programme. And it's really to bring the organisations together to support those people particularly working in the community and voluntary sector. You might remember about 3-4 years ago, the Home Office commissioned a review of second-tier organisations in the drug sector, and that led to what was called the Cordis Bright Report. And really what that did positively was to underline the important role that second-tier organisations can play. But really picking up on some of the points that Karen has highlighted, also that there are still significant challenges for the sector. Often the sector can work in quite a siloed way. It's not always that great at partnership working. Sometimes it can be quite fractious. And as we've seen in the last couple of years, the debates about what treatment effectiveness should mean and the way forward has at times, not least once the politicians have got on board, become fairly polarised, this sort of abstinence versus harm reduction. So given that context, the opportunities but also the challenges, bringing the four organisations together, I think has really been firstly a unique opportunity, but also a very important one and an incredibly timely one as well, not least for the issues that Karen has already mentioned, but that I'll say a little bit more about, and then we'll elaborate further when we have the panel discussion a bit later this afternoon. So the opportunities, a fantastic opportunity to really set a template, a model, as to how four quite different organisations can set about building a solid new partnership in quite challenging times, in quite a difficult policy and practice environment. Opportunities to share expertise, knowledge and intelligence. Yes, a new funding opportunity. The funding is $200,000 a year between the four organisations over the next 3 years, but also an opportunity to really add value in terms of what the respective organisations do, but also what we can do collectively and collaboratively. And what we've agreed right from the outset, and it might not necessarily have been entirely the position of some in government, this is not about forced merger. This is about adding value to organisations that each have their own mandate, their own objectives, and their clear stakeholder base. But of course, there are, in this new set of relationships, we represent different client groups. We have different stakeholders. Sometimes we compete for members. Sometimes we compete for funding. Those are all issues that we put on the table and said, well, if we're going to make this work, which we're committed to do, we really need to make sure that we recognise these potential barriers up front and from the outset. And yes, you will know that there are different histories between the organisations. Again, something we put on the table. We had a facilitated away day, and a very successful away day, I think it was as well. And communication and coordination for any partnership, any alliance, is always a challenge and an issue. What we also agreed from the outset is essentially the principles under which we will seek to work. That we are committed to working collaboratively, that we will take time to reflect and to learn. We will be accountable, very clear outcomes, very clear deliverables. It's an opportunity to learn across the organisations, as well as disseminate that externally. A commitment to diversity, but also recognising that we might want to speak with different voices as well as bringing the collective voice together as well. And also transparency. Talking about it here now, we report to every meeting of the Home Office Community and Voluntary Sector Forum, and of course are accountable to our funder, the Department of Health. Just whistle those on this. And the work plans that are underway, Adfam is leading on a workforce development and support project specifically for those individuals and organisations working with and supporting families. EATA is leading on drug treatment, delivering the drug strategy and the theme today, what are the future challenges for both policy and practice. The Alliance, supporting service user voices, better engagement and support, and they're conducting a series of regional consultation events both this month and next month to inform a new report that should be published soon. And DrugScope's contribution is to support the communications and the media work. We'll be producing a media toolkit to better support those organisations and agencies to work with their local and national media, but also to try and challenge where the media distorts or misrepresents, particularly when it comes to the work of local organisations. Supporting also the communications group that's come out of the Home Office CBS Forum and producing a website for the partnership, which hopefully after the meeting Thursday will be in a position to launch fairly soon. Well, the future, I'm only going to say